mild one. Yeah, if a patient says that he had 5 to 6 episodes, so we will consider it a major case, right? So, and we will also assess the hydration level as well, because the more amount of episodes, the more patient will throw the bicarbonates, and acidity level will increase in the body. So we have to check for all this. Was it forceful? That's a very important question. That is projectile, non-projectile. So what does that mean with the projectile vomiting? That means that patient didn't have nausea before, and suddenly he just opened his mouth and he vomited. So we will ask that was there any feeling of nausea before vomiting or not? So if not, it will be projectile. If non-projectile, patient already has nausea feeling, right? So mostly seen in gastroenteritis case and food poisoning, you have vomiting. So this will give a big hint about the diagnosis. What was the consistency? So that's important. It was watery, it was food content, or what was actually in the vomiting what was the material? So it will give a big hint about the quality of vomiting. What was the color? Greenish, reddish, yellowish. So usually it's a yellow, but because of it may contain bile, maybe due to perforation in the intestines, so it contain a bile content. So we will get to know that there is something done. What was what is the smell? It can be foul smelling. Usually you will say that smell is always foul smelling, but in certain diseases there is a particular smell. So what was the amount? Amount is very good to know that what is the amount. So we will guess that what other complications we have to look for. Did it contain blood or not? Because blood will give you a big hint about internal bleeding. If there is some internal bleeding, as in case of GI bleeding or any other bleed, so you will get to know that about the diagnosis. So next is, what about your fluid intake? After asking all these questions, you will come to the terms that it's a acute case, it's a projectile or not. You can rule out if it's a food poisoning case or it's a chronic case. It can be giardiasis, because in giardiasis there is foul smelling diarrhea and all, and vomiting as well. In the similar way, you have to ask about the fluid intake, if he is eating, or if he is able to drink anything or eat anything, because we will get to know that more about the condition, how serious it can get. So because after vomiting, as I have told you before, that it will lead to excessive fluid discharge from the body, and it will lead to dehydration, and dehydration will directly affect your kidneys. So that's all. Thank you, and comment guys, subscribe my channel, and comment for diarrhea if you want history of diarrhea.